Hello, I'm Dr. Colin Rudolph. I'm a pediatric gastroenterologist, and I've spent many years taking care of children with feeding difficulties. We see many patients who come to us as specialists after months to years of feeling frustrated that their child isn't eating right. Often, they say that they've been trying to talk to their physician about it, but the physician notes that the child's gaining weight appropriately and doesn't really think there's a clear problem. And in fact, often this might be the case, and some of these families, we tell them that their child is well within the normal range. Sometimes we can do little things that help normalize a relationship between the child and the parent during feeding that leads to a less frustrating feeding environment. But because there's a feeding problem, it doesn't mean that there's an underlying illness. The screening tool was developed by a group of experts from various disciplines. All of them are national experts who see many children with feeding problems. They included occupational therapists, speech pathologists, physicians, nurses, dietitians, and specialized psychologists, all of whom focus their practices on children with feeding disorders. Although we don't have data that clearly shows that this tool is effective yet, we do know that the individuals that met on multiple occasions to discuss the appropriate questions for a tool have based it on extensive experience. And what is being asked are the key questions a child that might benefit from further evaluation and management for a feeding disorder. When one opens the web page, the first thing you'll see is a question that asks you the age of the child. It will ask you to enter the birth date and to determine whether the child was premature. The reason for this is that then what will follow is a series of questions that really determine whether your child is functioning at a developmentally appropriate level. By this I mean that we'd expect a 3-month-old to be sucking from a breast or a bottle, but we wouldn't be expecting them to be eating steak. Likewise, if a child is 3 years of age, we'd expect them to be eating at a table, enjoying food, and taking a large variety of textures. The survey doesn't go further than 36 months. If a child is over 3 years of age, the screening tool will still ask questions appropriate for a 3-year-old. The reason for this is that we expect that by 3, most children have mastered the skills noted in the 3-year test. And if a 4 or 5-year-old hasn't mastered these skills, it is appropriate to then discuss this with your physician. After you complete the questionnaire, you'll then be able to print out a summary of your answers. It will identify areas of potential concern, and it will identify areas of normal development where you don't need to have any concerns. This then can be utilized to facilitate a conversation with your physician. It will allow you to very clearly talk about those areas that might benefit from further evaluation. Sometimes the physician will simply tell you that yes, it's a little outside of the normal range, but really the appropriate thing is to observe your child and watch their development over the next month or several months. And sometimes your physician will decide that it warrants further investigation and they'll refer you to another specialist, or they might do some specialized tests. In any case, the screen is not intended to identify what the problem is, but it's intended to help you communicate with your physician that there might be a problem. Often, physicians really want to help the family, but without a clear understanding of what the problem is, they have difficulty knowing what the next steps are. With this tool, you'll be enabled to partner with your physician in finding the best way forward for your child.
We need your help. We need your financial support. You can visit our website to learn more about our organization. We want you to know more about this. Please tell your friends about it. Please be our champion. We need to spread the word, and we're relying on you.